Well, I'm Carol Lehman. I'm on the faculty of Cincinnati Psychoanalytic Institute, and it's my privilege today to interview Dr. Bernard Foster, who is a long-term faculty member. And this interview is conducted as a part of Cincinnati's Oral History Project.
Well, I appreciate the opportunity to be interviewed. I think in anticipating the interview, it gave me a chance to do some reflection and maybe put some things together that I had not quite put together before about my past and activities that have gone on over the years.
Well, that's neat to hear that there's a benefit for you as well as for the people who will be looking at this in the future. And I picked up on the fact that you were thinking about your past because, you know, we psychoanalysts like to investigate the beginnings or the origins. And I think we also have this kind of tradition that we need to be aware of our own personal histories that have contributed to our being drawn to psychoanalytic thought and practice. So, I mean, you've been thinking about it. Could you share some of your early childhood experiences that you think prepared you for choosing medicine and choosing psychiatry as a specialty and eventually getting to psychoanalysis?
Well, one of the things I thought about that I'd never really put into the equation before was in my early life, early elementary school as I remember, there was a church Sunday school teacher whom I admired very much. And he was, you know, typically at that age you get the moms who are the Sunday school teachers or so on. This was a very distinguished man who was the county clerk of courts, which is an elected office in our county. And
What state was this again?
in Tennessee,
Okay.
and Oak Ridge, Tennessee. And he was one of the better educated people in the community. And I admired him for putting up with us, you know, little kids, and teaching Sunday school. And then at some point, he was charged with, I'm blocking on the term, maybe I don't want to think about it, but with stealing county funds.
Embezzling?
Embezzling, that's the word that I was looking for, and went to prison for it. And the reason I was thinking about that was I think it, you know, really challenged me to start thinking, well, how can people be that polarized in how they behave? How can I put that together, you know? And that maybe started something for me about trying to understand human behaviors and emotions. And then one memory I have later is when I was maybe 12 or 13, reading the headline of the local newspaper, which was about a schizophrenic person who had committed some crime. I don't know if she murdered somebody or something pretty serious that managed to make the headlines. And so I asked my parents, well, what is schizophrenia? And they hemmed and hawed, and the truth was they probably didn't know very much to tell me about it. But my interpretation was their hemming and hawing meant that it probably had something to do with sex as an 11 or 12-year-old. And so off I went to the city library to look up schizophrenia, because I was going to find out about what this was all about.
Right.
And of course, then as I read about it, I began to read more about mental illness, and however a 12-year-old can read about it. But then Freud came into the picture, and I got real interested in reading about, well, who was Sigmund Freud and so on. And that interest kind of continued off and on. And in college, I was a pre-med. I knew that I wanted to go to medical school, or I was pretty sure I did. And I got a job, as a lot of people did in college, on the psychiatry unit at the Duke Hospital at their medical center. Paid all of $1 an hour. And so my roommate also got the job, a similar job. And even though it didn't pay very much, it was really interesting. They let us sit in on the staff meetings and, rub shoulders with all of the faculty who were admitting their patients there. And so even though I didn't know a whole lot about what they were talking about, it was a good experience. And along with that, one summer I worked at a state hospital in Illinois, Elgin State Hospital, which was the polar opposite of Duke Medical Center. It was one of those long-term custodial care type hospitals with maybe 4,000 or 5,000 patients, which was par for the course. Yes. in those days. And looking back, they gave us huge responsibility that we had no business having. I would be the only staff person with a unit of maybe 50 or 60 chronically ill people. They knew more about their medications than I did. They would, at medication time, they would come up and say, I take one orange pill and 2 blue pills, which was Thorazine and Stelazine in those days. And so I'd give them 1 orange pill and 2 blue pills.
So, and this was when you were in medical school and they had you dispensing meds?
No, this was when I was an undergraduate.
Oh my goodness. Okay.
With no training. They just said, well, the patients will tell you what they take. And it was a very casual attitude about the whole thing. So I continued to be interested in psychiatry, and then in those days, after medical school, you did an internship a year and then chose your residency. It's all combined now, so that you do the first year of residency is kind of like an internship here.
But in those days it was quite separate.
Quite separate, yes. And I had really enjoyed psychiatry in medical school at McGill, which was pretty analytically oriented.
McGill was where you did where you went to medical school.
Yes, and the chairman there was Robert Cleghorn, who was an analyst himself. And as I said, I'm interested in psychiatry. Could he recommend some residency programs? At that time, his son was a resident here in Cincinnati, Jacques Cleghorn. And so he spoke highly of the program and said you might think about that. And so when it came time to look at residencies, I chose residencies that for as well as you could know, were analytically oriented. Cincinnati being one of those, and turned out that it was a good place for me to come.
And you arrived here
in '68.
In '68.
I was thinking, as we're doing this interview, the television program about Ken Burns' history of the Vietnam War is occurring, and the episode tonight is going to be about the summer of 1968 when the Democratic Convention was going on. And
that momentous summer.
Yes, indeed. And I was thinking, well, that was the summer I came to Cincinnati, and being a beginning resident, I was much more preoccupied with how do you get started in this residency program than I was with the political scene. But it was certainly a tumultuous time, and it was a tumultuous time in Cincinnati itself.
Yes.
You know, at that point. But it was a very interesting time to be here to experience what was going on in the community as well as in the psychiatry residency, and how they reflected on each other. I think we saw a lot of people who were emotionally traumatized in some way or another by the experience of Vietnam and the turmoil in the country.
It was a very divisive time.
Oh, it was.
Intergenerationally.
Yes. You know, and I think a lot of people who were already dealing with their mental illness experienced that as a very disturbing time for them, a loss of stability. And I think I didn't really appreciate how important ongoing stability is to people with chronic mental illness. I remember one of my favorite teachers in the department was Walt Stone, who was very interested in chronic illness and groups. And we did a sort of a survey type study of what people did with their time and what was helpful to them and what wasn't. And one of the things that emerged was that listening to the Reds baseball games was very important, because it was something they could count on. It happened every day just about in the summer for over a long period of time, maybe 4 or 5 months. And they didn't care who won. They just liked the idea that this was something that was stable in their life.
And was that when you were connected with an inpatient unit that you particularly noticed that?
Well, it was actually an outpatient group that we were
your outpatient group. Okay.
That we were working with of chronically ill people, sort of hoping to find ways to be helpful to them in a group setting. You know.
You mentioned Walt Stone as being one of your favorite teachers. Do other teachers or supervisors come to mind? I know that was the era of Maury Levine.
Yes, he was the chairman of the department, and you know, it was a much accoladed department of psychiatry. Maury Levine was known nationally as a very effective teacher and of particularly psychiatry residents, and he had developed a department of really good people, we thought. Some of my favorites were people like Jim Titchener, Paul Ornstein, Anna Ornstein, John McLeod. Don Ross was there, and Janet Newman. Tilly Krug was the head of the child psychiatry division. And we got really good teaching in child psychiatry, even though if you were in general psychiatry residency. As well as a lot of visiting teachers. One of my teachers from McGill, Heinz Lehman, was a leader in the development of psychotropic drugs, and so Dr. Levine would have him come every year for a series of conferences. He liked to invite people who might fill in the gaps that he thought were there in his own faculty, you know, like psychopharmacology. But he also wanted to expose us to other disciplines, so that there were people from the university who came in philosophy, economics, literature, There was a very exciting seminar that took place on psychiatry and literature that a teacher named Jim Robinson led, and everybody loved that. That was a lot of fun.
Mm-hmm.
And then Margaret Mead came
Right.
just about every year and stayed for a couple of weeks, and we would have these very concentrated learning experiences with visiting teachers. So it was a good faculty, and they were all analysts except Walt wasn't an analyst. He was very analytically oriented and wrote lots of analytically oriented books about group psychotherapy. But then when the Institute started in the first class was in 1973. The planning stages had been there for several years before, and I finished my residency in 71, which was the year that Maurice Levine died.
I see.
And he had a very short period of illness with leukemia before he died.
I've been told that his loss was very, very deep for the department.
It was. He was a beloved teacher and model and
An analyst of many people, right?
oh yes, yeah, and he was one of these chairpersons who believed that he should do most of the teaching. So he had seminars
Wow.
at all levels and departmental level seminars, and I can well remember when I was a first year resident, I thought they were speaking some foreign language that I did not understand, because we just didn't know the vocabulary yet, and it was fun to trace one's development through the course of the training years, and how much more comfortable you became each year with what was being talked about. I'm not sure that he was all that in favor of developing an institute here. He might have been, and I think he was on the planning committee. But
What do you think his reservations might have been about that?
well, I think he was concerned that it would take away time and energy, probably more energy, from the faculty, because most of the proposed faculty for the Institute were people who were on the Department of Psychiatry faculty.
So that they might neglect the residents or the resident, teaching the residents and
Right,
developing their programs
Exactly.
in favor of the
Of the
psychoanalytic
Institute.
training.
right.
How do you think that worked out?
Well, I think it worked out okay. Of course, I wasn't a resident when the Institute started, so I didn't get to experience it from both sides. But the Institute was very closely emotionally tied to the Department of Psychiatry, but it was not administratively tied to it at any point. It was a separate entity. John McLeod was the first director of the Institute, and he remained the director for many years, I think maybe 15 to 17 years, something like that. But that was before this building that we're in now. The Institute building was built, and we had our classes on the 8th floor, which was the psychiatry unit at Cincinnati. The University Hospital is called now. It was called Cincinnati General originally. But that's where we had our classes, in the seminar rooms there. And that happened starting in the fall of '73.
And you were in the first class, I think you told me.
Yes.
And one time you told me about going to Chicago to have your pre-admission interviews for
Mhm.
analytic training. And some people might not know the relationship between the Chicago Institute of
Oh,
Psychoanalysis
sure.
and the Cincinnati Psychoanalytic Institute,
Mhm.
and what that relationship would have been like in the beginning days.
Cincinnati was initially what was called a provisional institute under the aegis of the Chicago Psychoanalytic Institute. That was both to make sure that they were doing things right here, but also to provide support and supervision, as it were, or to answer questions and help out. And indeed, many of the visiting teachers, both to the Department of Psychiatry and to the Institute, were from Chicago. Nearly all of the people who were on the faculty, both in the analysts in the Department of Psychiatry and then in the Institute, had their analytic training in Chicago. I think some of them had their analysis in Chicago too. They would go and have, double sessions. So they would maybe go on Friday and Saturday and have 2 sessions each day,
And also take classes, then, I assume.
and take classes. Yes, and it was, and for a long time, they rode on the train to get there. And then they began to fly in the 50s, I guess. But I can remember hearing stories about the train trips that they made, and
It was quite a commitment.
oh my
to be
goodness,
gone
it was
Friday and Saturday, overnight,
yeah,
when you already had families and
right.
practices here.
And I've periodically asked myself, well, would I have been willing to make that kind of commitment? Because as I was entering, I knew that I could come here,
Mm-hmm.
and that was not going to be nearly as painful. But I think I would have gone to Chicago too, because that's where everybody that I knew who had gone before me had gone, and they managed to survive. And so that provisional status, I think, by requirement of the American Psychoanalytic Association at that time, went on for maybe 4 or 5 years, gradually diminishing in its level of oversight as they got more comfortable with, well, people did know what they were doing and they were doing a good job and that sort of thing. And so it was not a big transition for most of us. Like in my class, there were 5, all men, all psychiatrists. I don't think there wasn't a choice about the psychiatry aspect of it in those days. It was later in the 70s that analytic training opened up to other mental health professionals, in particular psychologists.
Right.
But in the early 70s, it was limited to psychiatrists, and there weren't many women. I don't think there were any women who even applied for analytic training. And I was trying to remember who might have been the first female candidate here. I think Helen Tucker might have been,
Okay.
but I'm not absolutely sure about that. So there were 5 psychiatrists. They were all trained in Cincinnati except Dick Brush. He had trained at Ohio State. But the other 4, myself, Bill Carney, Jim Shaw, and Clayton Gottwals, had all been residents here. And so they already were comfortable with the faculty, and I think the faculty was pretty comfortable with knowing who we were, because they taught and supervised us in another setting. They were anxious too in the beginning.
Your teachers, you
the
mean?
teachers,
The faculty?
Yeah. And looking back, I think they were probably a little stiff and over-prepared, or, not sure that how much they could wander out of the box and what they were teaching or that sort of thing. But, that was notable to me, having seen them in other teaching settings, where they seemed more comfortable. And certainly that was understandable. They were being scrutinized
Right.
too.
Right. They wanted to succeed so that they wouldn't be provisional forever.
Right,
Yeah.
right.
Were there any difficulties in getting training cases? What
Well,
was that experience like for you?
I think everybody would say that it was difficult to get them, but certainly looking back, it was not nearly as difficult as I think it is today. At that time, we were discouraged from converting people from psychotherapy to analysis. The idea was, sure, they're going to be in psychotherapy before getting into analysis. Nearly everybody would be, but you should refer them to someone else for the analysis that would make it a more pure analysis.
That was the idea.
That
then.
was the idea, the pure blue flame of analysis. And so usually we did, we refer among ourselves if we thought somebody was appropriate and they were interested in pursuing analysis. But a few were converted and went on with the same person. Insurance was a factor, because more people had insurance coverage in those days than they certainly do at this point. Or they may have some insurance coverage now, but it doesn't take you very far if you're in analysis to run out of your benefits. Where in those days, both for people who were in a training analysis, like myself, you could get very good insurance coverage through the VA system or other settings as well. And patients could do something similar to that. But that all went away probably in the late 70s, early 80s, that kind of insurance coverage, and that made it more difficult to find patients.
What was your experience working with your training cases, and were there some surprises? Were you, you were yourself at that point on the couch in your own analysis, and then you have your own patients where you're the analyst. Did you, and I'm sure you also had experiences of doing psychotherapy before you
Sure.
were doing psychoanalysis.
Well, I think like everybody, I was very anxious about, having people on the couch. And they were very anxious about being on the couch. And that just took a lot of getting used to. But it worked out, as I'm sure was your case, that once it became the way that we were doing things, then people adjusted to it. Or they didn't, and then there were reasons for that. Some people couldn't tolerate being on the couch, and sometimes you could analyze that, and sometimes you couldn't. That was their way of letting you know they needed to be doing something else. On the other hand, I remember one patient who was in analysis for a long time, and then we came to the end of the analysis, and a few years later she wanted to come back for some psychotherapy. But she thought the only thing to do was lie on the couch. I was seeing her once a week, and eventually once a month, but always on the couch, because that was the way we did things. That was the more natural way for her, you know. That was my only once a month analysis that was going on.
So you could be flexible.
Right,
and,
right.
And do what was comfortable for her, or what she was used to.
What worked for her.
Right.
Yeah.
Right. And you were doing that. You were working for the department as you were doing your training. So.
Yes, yes. I started off at the VA hospital as a supervisor of one of the units there, and supervising the residents who worked on that inpatient unit for 6 months rotations. And I was doing that for about 4 years. I was thinking about who some of the residents were. My first two residents that I supervised were Dick Honig and Jerry Kay, which was quite a pair to be working with, and they both ended up getting into analytic training, and several other people since then. And that's been one of the rewarding things about being in the Institute and then the department over the years, is watching people progress and have good experiences. And
Dick, of course, was one of the joint directors here at a certain point, and
right.
Jerry Carey had a long career with Wright State Department of Psychiatry.
Right. So I did that for 4 years, and then I moved over to Central Clinic and was the director of the adult outpatient program, psychotherapy program there. That was about the time Bob Stewart had been the director of the clinic when I was a resident, and for a while afterwards, and then he left and Walter Smithson became the director. And that was a good job. I enjoyed that. Did a lot of teaching, and that was the beginning of my analytic training. And the department was organized in what Dr. Levine had called a geographic full-time faculty appointment, which meant that you got an office geographically within the department, and you were there full-time, but you were expected to make most of your money seeing private patients. And he would pay you a small salary, as small as he could get away with, probably.
I see.
Yeah, but people did all right, you know.
But the expectation was that there would be time for you to see patients, or
right. And that was fine. And I think the attitude was that your being clinically involved with patients was additive to your teaching. It enriched your teaching because you had patient experiences that you were relating to as you were teaching about their clinical experiences.
And did you also have social workers and
Yes.
psychology students who were at Central Clinic at that time?
Yes. Thank you for remembering that. Yeah, most of the social work students were from Smith College, School of Social Work, and as a result, there were lots of Smith graduates in this community who had trained at Smith, which was a very analytically oriented program, and they would send their students here for their internship year, I think it was called, their clinical experience. And the same was true for psychology graduate students. Most of the psychology graduate students came from UC, but not all. And some people elected to come here from other programs because they thought it would be a good clinical experience. And that really made it, I think, a very rich learning experience to do seminars with all three disciplines in the same group. The department was very supportive about analytic training. I don't think they ever questioned, well, are you taking time away from us by going for your analytic training? I think they saw it more as, this will make you a better teacher. And that was very much appreciated, that you didn't have to fight any battles about that. I'm not sure that's always the case, or that it's still true in the department. I know I've certainly spoken with candidates who are involved in agency work, for example, where the director of the agency is not encouraging of their going for analytic training, taking Fridays off and things like that, and they have to work out other provisions to make up for lost time and that sort of thing.
So it would have been a very different experience to feel like
Yes.
it was seen as an asset, something you could give back to the department.
And I think they were sort of proud of us that we were doing this. It was encouraged, and part of that might have been because we were doing what they did, and following in their footsteps, and they supported that. And then after a few years at Central Clinic, I followed Jack Lindy as the director of residency training. And that was a fun, interesting, difficult experience, as you might imagine. And then in 1982, I graduated from the Institute in 80, and in 82 I came here to the practice at Highland Avenue. And as I was thinking about that, I thought, well, that's the model is the same as Levine had in his Department of Psychiatry, because basically what people do here at the Institute is they're geographic full-time. They have their office and they see their patients, but they also teach for very little money.
Right.
And not everybody is in the department, or in the building, of course. Lots of people like yourself or have offices elsewhere in the community, but
there's that opportunity to teach, to serve on committees.
right, yeah. And so the transitions have not been all that radical from being just in the Department of Psychiatry to being in the Analytic Institute and how we do things.
So once you started your full-time practice, did you curtail your involvements with the department?
Somewhat. I still did a lot of teaching, particularly psychotherapy seminars, and then I got interested in ethics, and so I did most of the ethics teaching. And at some point, we arranged for the residents to come here rather than our being the institute faculty going over there to do the teaching. For one thing, this seminar room lent itself, I think, to more privacy. It was quieter. It was more pleasant surroundings. One of the problems in the medical school and in Central Clinic is there's always construction going on, and lots of times air conditioning was not very good, and so you had to have open windows, and you couldn't hear, and on and on and on. And so it was fun to have the residents come over here, and it was also a way to introduce them to psychoanalysis.
Right, to the library and
right, yeah.
resources that were here.
Yeah. And that's been especially important over the years as the department's orientation has changed. It's much more biologically oriented now than it was 20 years ago, for sure. And so it's a way to say, well, here's something else that you don't see very much in your day-to-day life at the hospitals or in the offices of your faculty members over there.
Well, you've talked about playing any number of roles with the Department of Psychiatry, and I know that's been true here as you've been a private practitioner in the practice, the Center for Psychoanalysis, and then also a faculty member in the Cincinnati Psychoanalytic Institute. So I thought it might be good to talk about your experiences, as a teacher, serving on committees. You were a part of the leadership, a co-director at a certain point. Where do you want to start with that part?
One of the things that I was very interested in and got very involved with was organized psychiatry, the Ohio Psychiatric Association and the American Psychiatric Association, and I became president of the Ohio Psychiatric Association and a member of the Assembly of the American Psychiatric Association. But what I got interested in psychoanalysis was outreach kinds of things and making psychoanalysis relevant to the outside world, as it were. For instance, I was seeing a pattern of fewer and fewer analysts being involved in organized psychiatry, and so I thought that would be a place that I could make a contribution and present an analytic point of view rather than just absenting ourselves from those kinds of activities.
And losing a voice then if
Exactly.
psychoanalysts aren't there
Yeah.
to present cases.
And there were some people who were good models for me. There's an analyst in Cleveland, Drew Clemens, who was also similarly involved in organized psychiatry. And he and I worked on some projects. For example, at that time, Medicare did not cover psychoanalysis. And so we jointly worked for a long time to convince the carriers, Medicare health insurance carriers for our region, which is Ohio and West Virginia and Kentucky, I think, that they should cover Medicare, and we were successful. And
I hadn't heard that before.
yeah, that was
That's
a
wonderful.
that was a coup for us.
Right.
And then it became more of a national phenomenon after that.
So that it started in Ohio first?
I think so, yeah.
Wow.
I mean, other people were working on it
Mhm.
similarly, but I think we were the first to be successful with it. And, had two analysts not been involved in organized psychiatry and been able to use that clout to convince the Medicare carriers, I don't think it would have happened.
Mhm.
So that was a choice I made because I didn't feel like I had the time and energy to do both, become a training analyst and do that. And it suited me better, I think, to do organizational and administrative kinds of things. And it fit with my interest in doing outreach. At that time we had what was called an extension division, and we planned programs for the wider community. And looking back, they were too elaborate and not listening closely enough to what the community needed. It was more, well, we're going to present something and you should be interested in this community. So sign up and come. And sometimes they did and sometimes they didn't. But the idea that that the Institute was here for more than just training future analysts was important, I thought, and making psychoanalysis relevant to the larger community and was important. And in a similar way, I thought it was important for people like myself to be on boards.
Tell me about the boards you were a part of.
Well, the Mental Health Association was probably the most important from my perspective, and the one that I was associated with the longest time, most rewarding. But part of the fun for me was, usually boards like that have one or two mental health professionals, but then they have all kinds of other people from the business world or from the academic world or advertisers, people who had all different ways of thinking about things. And that was fun. I could learn from them new points of view and how to get things done. Analysts aren't very good at getting things done. They're very good at talking about things and mulling them over and then mulling them over some more.
Right.
But to see how the business people actually did it was interesting. And by the same token, Cincinnati was unique, I think, at the time in all of American psychoanalysis in having a community board as its governing body. The Institute, and that was John McLeod's idea, was that it would be important to have oversight of the Institute by members of the community. And as well, it was a good way to get financial support for the Institute from the community. So that model was there of, what can community people contribute? And they have contributed enormously, I think.
They have indeed.
To our Institute. When we compare ourselves or when other institutes compare themselves with us, they're usually envious of the endowment that we have. Most institutes do not have that. And the things that it allows us to do, even though we're, comparatively speaking, a very small institute in a very small community.
And you got the opportunity to be a co-director with a new model of directorship.
Right.
Remind me that year, 2004?
I think it was 2004.
And it was Jack Lindy, who was coming back after having been a director, and Ware Willity, and yourself,
And myself.
who worked out a co-directorship. Can you talk about what that was like? And
Well, for one thing, I was kind of stunned to be even asked. That was not one of my ambitions to be an institute director. Nor did I think that was something that was to be considered, because the pattern had been to be a director you had to be a training and supervising analyst. And I wasn't, and Will really wasn't. Jack was. But his idea was that this would be a good way to approach it. So I think people were seeing being the director as being a pretty consuming kind of job that would take a lot of time and energy, and so it wasn't that attractive, or that was sort of the general notion that people had.
That was
but-
kind of an impossible job
Impossible, exactly.
and a thankless job, I guess,
Yeah.
or it could be.
And stressful, because so much came your way. And Jack's idea was, let's share it. Let's get more people involved in being director. We can divide up the responsibilities, but we can share with each other, and then it won't be so isolating. And this idea that it gets lonely at the top. Well, I think it does. Even though people want to be very supportive. I think that was the case with John Hall, that he had a very good support team, but still they weren't the director. And eventually the buck stops there as the director. So Jack's proposal, and he worked on it. It wasn't like Ann and I said, yeah, gee, we'd love to do that. It took some convincing, both of us and I think of the board and the faculty.
Something new.
That this could work. It was new, and new is always met with resistance of some kinds, and it takes some very special planning and thoughtfulness and footwork to be able to make changes in administrative situations. And analysts are probably as bad or worse than anybody. We tend probably to be orthodox and stodgy and not wanting to change, and so even a proposal like, well, let's have 3 directors instead of 1 was pretty radical, and took some maneuvering to get through. But I think it worked out.
I think there's a general feeling that it worked out, and that people are grateful that the 3 of you helped the Institute through a tough time.
Well, I appreciate you saying that. It was a tough time for the Institute. There were a lot of distressing kinds of things going on, particularly in the area of possible boundary violations and things like that that were very disturbing, and sort of ate away at the social structure of the Institute. I think what it meant for people to be on the faculty or be a member of the community.
Sort of a loss of, in some ways maybe a loss of trust, a loss of confidence in ourselves.
Yeah.
To live up to our values, and some
And
identity
it
things.
wasn't available then, as we know. There's now a considerable body of literature about that very phenomena, that what can happen to institutes, not just to Cincinnati, but to any institute when it experiences something like a boundary violation, an ethics issue, sometimes expulsion of a member, and sometimes a revered member. I was mentioning Dick Honig earlier, and he and a colleague did a very interesting study of another institute, and wrote a paper that was in the American about that phenomena of how it was experienced by that institute.
and how they kind of worked to find their healing and a new footing.
Yeah.
Right.
Which brings up, another area of interest along with extension and community involvement. I didn't purposely initially get interested in ethics. I was, everybody's on committees in the faculty, and
Yes.
I was on the ethics committee.
More than one often.
You're right, exactly, lots of committees. And that didn't really mean anything for, I probably was on the ethics committee for 10 years. I don't know if we ever met. It was just there because we needed to have an ethics committee. And then we began to have some issues that an ethics committee needed to address. And so by that time I was the chairman of the committee. And so it was a matter of educating ourselves about what is this all about and how do we do it, and getting lots of consultation. And the American was very helpful in that regard also.
And setting up structures, I think, so that there was fairness in terms of to the faculty member who might have been complained about and to the patient who was needing to file a complaint.
Right. Yeah, that's a good point. It was, and that was something that people didn't always understand, that there needed to be due process.
Exactly.
And that there were differences between what the ethics committee would do or could do and what the administration of the institute could and should do. That the ethics committee had responsibility sometimes for a person's professional life, and that due process was very important, and confidentiality was very important, and people
Yes.
didn't always understand that either.
Right.
But we got through some situations, and in looking back, I feel a sense of pride about how we all did with that, because I think people did understand what they needed to do, and they were very conscientious on the ethics committee and those who worked with us.
Trying to do a good job in a very difficult circumstance.
Yes, it was. I learned a great deal in the process, and I hope others did too. And it certainly enriched my teaching efforts in ethics. I came away with the idea that really the most important job that the ethics committee can do is not to adjudicate complaints, but to educate.
Right.
And prevent when possible. And you have, being the current chairman of the ethics committee, I think done a superb job of carrying that forward in the workshops.
Yeah. Well, thank you. And it's partly because we could, after some difficult situations were adjudicated, we could shift gears and look more at education, which is, we teach classes to the candidates and to the advanced psychotherapy students, and also do periodic workshops, which are lots of work, but generally well received.
Yes, yes, they are. And I think people are much more aware at this point of the whole ethics scene, and understanding what that can be about. But I was saying earlier that you know, the anticipating this interview, it allowed me to tie some things together, and I think that was one of the things, you know, that Sunday school teacher that I talked about back in the beginning, and his embezzlement ethics violation, as it were, you know, was not unlike what we see if there's an ethics violation at a professional level in the Cincinnati Psychoanalytic Institute or any other professional organization. You know, these are usually high-functioning people who have done something that's very hard to understand, and you would think, you know, you would expect a better level of judgment, and yet this has happened. Well, it's happened for a reason, and can we understand what some of those reasons are? And can we both do preventative kinds of things, but also rehabilitative kinds of things? You know, I think that's one of the saddest parts of some of these ethics outcomes, is that you lose somebody, perhaps unnecessarily, from the profession or from the community because of an ethics issue that has excluded them. Not everybody agrees about that, you know.
Yeah, that whole question about who can be rehabilitated and
Right.
who can't,
Right.
and whether, you know, one strike and you're out or not. That's
Right.
very controversial at the moment.
But it also reflects, I think, what goes on in the rest of the world, in the criminal justice system, for example, you know, where there's a whole spectrum of responses that range from one strike or 3 strikes and you're out to can you be rehabilitated and become a contributing member of society, you know. So that's been a rewarding part of the experience, I think, for me, of being in the Institute, one that I wouldn't have asked for, but there it was. And
Yeah, and it's really interesting that to see how you can trace back your ability to think humanely about violators and remember as a kid, your own puzzlement about this Sunday school teacher whom you admired, who could then do something against the community of the church, like, you know, embezzle money, and you know, try to work out how that could be and how you understand those things.
I remember once, I don't know, it was at a cocktail party or place, I was having a conversation, and this person was asking me about, you know, my family and what, I have 2 younger brothers, and so he was asking about what they did. He knew that I was a psychiatrist and psychoanalyst, and one brother is a criminologist, academic criminologist, and the other brother is an attorney.
I see.
The person who was listening says, "Wow, your family's really into aberrant behavior, aren't they?"
Did your brothers have the same Sunday school teacher?
They did, as a matter of fact.
Yeah, they would have had, so they
maybe
could have also have been impacted by that situation.
That's a good point. It very well could have been the case.
Yeah. I know that you feel like you have learned some things about the practice of analysis and issues of self-care and living a balanced life from some of your work on the Ethics Committee. Do you want to share a bit about that?
Sure. Well, one of the things that, you know, becomes very clear when you're looking at people who committed boundary violations is that they often have not been living very balanced lives, and that they're seeking things in their professional relationships with their patients that they really should be experiencing outside of their professional relationships, whether it's nurturing or love or whatever.
Intimacy.
Intimacy, right. And the importance of having a well-rounded life with healthy relationships and other interests besides psychoanalysis or psychiatry or whatever your specialty might be can go a long way toward keeping a healthy relationship with patients.
Right. And I believe you told me that you met Rachel, your wife, when you were in high school?
Yes, yes, I did.
Married after undergrad, and so she was with you in Montreal and San Francisco, and then made the move to Cincinnati. And
yeah, she's been through the whole process, and you're saying it that way reminded me. I recently went to a baseball game in Louisville with my brother who lives there, the Louisville Bats, which is the farm team for the Reds, and he knew the ushers and everybody. It's just a small stadium, and so at some point in the game, I was talking to my wife Rachel, and the usher came over. He was an older man, as most of the ushers are at baseball games, and he is teasingly saying to Rachel, "Is this man bothering you?" And Rachel says, "He's been bothering me for almost 60 years now." so yeah, she's
Nice.
been there all the way through, and has been very supportive, and that's been an enormously important part of the whole life experience, and very enriching, I think.
Mm-hmm. And now you have kids and grandchildren.
We do, and one of the reasons for my decision to retire was that I was realizing our son lives in Florida, and his children were growing up. They're older than the other grandchildren who live here. And we didn't have the same relationship with them as we have with the grandchildren here, because we just didn't see them that much. We would, see them for short periods of time, several times a year, but not on a regular basis. So with retirement, we can go and spend a more extended periods of time, and that meant a lot. I think there were lots of reasons it was time to retire. One of them being that I had decided from my ethics experiences, both at the Institute and in the Ohio Psychiatric Association, that impaired judgment is a major contributor to some of the boundary violation kind of experiences that people have. I don't think they would have happened in earlier life. And it's subtle, it's not like they have major cognitive impairment or anything, but subtle changes in their judgment. And I decided I didn't want to get to that stage, or to be at the stage where people were saying, isn't it time for you to retire?
You'd like to be proactive.
And be proactive about that. And I still, do some teaching. And
Indeed, and you're still serving on the ethics committee.
Yes, for better or worse.
No, for better, I think.
But it's been a time to get an even broader experience of things to be interested in, and because being in practice is very demanding. And when you go home, you're thinking, I'd like to read this novel, but reading this journal is probably more important or more pressing at this moment, or getting ready to teach this seminar or that sort of thing. And so there's a tendency to be kind of narrow in our interest, and the chance to expand has been important. Although, you know, one of the reasons I liked psychiatry in the first place was there's hardly anything that you can do that doesn't have some psychiatric application.
Uh-huh.
You know, any movie you see, any book
Right.
you read, any new person you meet, whatever. Which you can't say if you're a surgeon or
Mm-hmm.
in a more limited field.
Mm-hmm.
You know.
There's a richness there with
There
which you
is. There really is.
go to movies and or read books or discuss
Mhm.
books.
Mhm.
Right, right.
But I feel optimistic about the future for psychoanalysis. That
I was wondering if you had any thoughts about the future of psychoanalysis that you might want to share.
Well, my own approach and hope for analysis is that it will continue to really work hard at being relevant and involved in new ways to bring psychoanalytic understanding and thinking to the community. You know, there are lots of competing, I would put that in quotation marks because I don't think they're really competing, but lots of other points of view that like to diminish psychoanalysis and say ours is better or this sort of thing. One of the things that appealed to me about psychoanalysis was more than any other way of understanding the mind, I think psychoanalysis does the best job of explaining most thoroughly and usefully how the mind works. Now, there are lots of things that have been added to or re-understood or better understood through the years, but that remains the bedrock, I think, of all human mind understandings. You know, it makes me think, there's this saying, think out of the box. Well, you've got to have a box first before you can think out of the
Right,
box.
Right.
And I think psychoanalysis is an excellent box to start with, you know, if you can really get a good grasp on what's in that box, then you can go all kinds of directions. And I hope that analysis will maintain its relevance, and that's going to be challenging in today's world of cyberspace, and you know, that's a whole new topic in ethics. Is
Indeed.
You know, what are the boundaries now that we have ways of communicating that we didn't have not so long ago. You know, can we do internet therapy, or what happens about confidentiality, all kinds of things like that. But I have started reading a book by Tom Friedman. He's a writer for the New York Times.
Right.
And he is kind of a futurist. And he wrote a book entitled "Thank You for Being Late." And the subtitle, I think I wrote it down here because I can never remember exactly what it is. The subtitle is "An Optimist's Guide to Thriving in the Age of Accelerations." And the bottom line of his book is that the people who are going to be best suited for surviving in the age of accelerations are those who can adapt, those who are comfortable with lifelong learning and those who are self-motivated. Well, can you think of a group of people who fit those criteria any better than psychoanalysts? You know, nobody made us get into analytic training. We never stop learning.
And we love the field because of that.
Exactly,
Uh-huh.
exactly. And it's all self-motivated, you know, nobody else. We might be encouraged, but we have to do it ourselves, and at great sacrifice in most cases, I would say, both financially and in terms of commitments to other activities or to family. So we're lifelong learners, and we're self-motivated. If Friedman is right, we fit right into the future. The question is how to do that.
How to adapt.
Yeah. And I think analysts can do that. So I feel hopeful.
Well, it's nice to end on a hopeful note. Yeah.
Good. I've enjoyed this.
So have I.
And I hope that other people will get this opportunity to participate in the Oral History Project for this institute. I think it's useful for all concerned.
I agree. I agree. Thank you for being willing to share.
You're very welcome. Thank you for inviting me.
Well, it was an honor.